Assalamualaikum warahmatullahi wabarakatuh. My name is Adam Zulkifli, and today I would like to present persistent epithelial defect. So, what is persistent epithelial defect? As defined here, it is the injury to the cornea, specifically epithelium, that do not resolve within 2 weeks, 10 to 40 days to be exact, even with standard treatment. So, the anatomy of the cornea. First thing first, it is an avascular structure, meaning it doesn't have blood vessel, and it holds most the refractive power of the human eye, 75% to be exact, and it allows light to pass through. It is the anterior layer of the eye and anterior to the pupil, iris, and anterior chamber of the eye. Now this is the most important part of the cornea, which, as you can see to the picture, have 5 layers: corneal epithelium, Bowman's layer or anterior limiting lamina, stroma, substantia propria, Descemet's membrane, which is the posterior limiting lamina, and lastly endothelium. Okay, this is a very complex part, but I will simplify it for you. So, before persistent epithelial defect can occur, it will usually begin with normal corneal injury, such as abrasion or stretches to the cornea of the eye. So, first phase, basically basal epithelial cells will prepare themselves to migrate by having anatomical changes, such as becoming more spherical or rounder. Next is migration phase. Well, it is an active phase, require ATP, and the basal epithelial cells will migrate themselves to close the area of the defect or the gap. The proliferation phase, where the basal epithelial cells will proliferate and differentiate themselves to transform into wing cells or superficial cells. And last phase is the attachment phase. This is where the number of intercellular junctions will increase, such as hemidesmosome and desmosome, which both of these function to adhere the cells to the basement membrane. Next, there are 2 outcomes. First, during normal condition, the epithelial layer will be actively repaired over and over again over the course 7 to 14 days. Specifically, the basal epithelial cells will continue to proliferate and differentiate until the normal thickness of the cornea is reached. But what happens if there are some abnormalities, irregularities occur during the wound healing process? This will cause the wound healing process to persist. But if it persists after 2 weeks, it will be classified as persistent epithelial defect. So, persistent epithelial defect. Refer to the next picture. It causes the stromal corrosion, which you can see, and due to this, the epithelial cells cannot migrate to the site of the injury or the area of the defect due to having no basement membrane, and this will cause them to grow over the edge of the lesion. Okay, the signs and symptoms of persistent epithelial defect. First, you will feel foreign body sensation inside your eye, where it will make you feel very uncomfortable. Next is the conjunctival injection, which is basically the enlargement of the conjunctival blood vessel in your eye, which will cause your eye to be red. And next is the photophobia, where basically your eye will be very discomfort in bright light. And last is the blurry vision, where your vision will not be clear and it will be blurred. This is the end of my presentation. You can refer to these references, and thank you very much.